funny that that machine has a sort of a lisp. Have you noticed that? So here we are. This is the meeting of September 1st of the Board of Health, and it's virtual, and we're recording it, and away we go. Can we approve the minutes from August 18th?
So moved.
Yes. Second.
Okay. Anybody not in favor? All right. Hearing no objection. I forgot about those minutes from February 17th. So, I mean, it's hardly urgent. I'll try and remember to do them next week in time, or 2 weeks from now, in time for you guys to review them. They haven't even been drafted.
I imagine we talked about COVID.
Yeah, I imagine we talked about it quite a lot, but I have notes, so whatever. I wouldn't bother, but Grace was pressing me for them. So Greg Steve has requested, I had to kind of hold his hand through this process, but he has requested an extension to the deadline, an extension to the extension, right? He had a deadline for having a demolition plan and timeline for August 1st. We extended it to September 1st. Now he's asking for another month, which is, I think, as much as we should extend it at a time. He actually is making a little bit of progress on that. As you know, it's really hard to get anybody to do anything right now. So he is facing that. He has contacted 3 demolition companies. I think one of them wouldn't even talk to him. I think 2 came out and looked. One of them gave him a quote. Unfortunately, the quote is at least twice as much as what the insurance company has budgeted. So he's back to negotiating that. But in any case, he's making some progress. He's not just doing nothing. And he sent me his emails are a little bit hard to follow, but he sent me an email explaining all the ways that the windows of that place are secured, and asked to be not required to board them up. And I said, fine, right? This is already a big expense and a big pain for him. Nobody has broken in yet. He's made it difficult for anybody to break in. Charlie sent me this. I don't know if I send it around to you guys, this huge flyer from the Fire Departments Association or something. It's all about how to make a place really secure when it's vacant. But the context of it is a building in a city that is vacant and basically not being guarded. Right, so a building that just nobody is having anything to do with, whereas Greg goes into his house daily to salvage things or do things, and it just doesn't seem like that big a deal. I mean, it's not going to be turned into a crack house overnight or something, which is the kind of thing that flyer was for. So I went ahead on my own initiative, and I just said, fine, concentrate on the thing that really matters to us, which is getting the building torn down. So I hope everybody's okay with that.
What did the 3rd contractor say?
He only got one quote.
Oh.
He got one contractor didn't come out. One wouldn't give him a quote, and one did. So he's only been able to get the one quote, although I'm sure he would like to have more than one. And I don't think there are that many demolition contractors around. It's not a huge field as far as I can tell. So that's what he has achieved so far.
And are there no pressures put on him from the insurance company around this?
It's the insurance company, at least in part, that has held him up. Long after the fire, I ran into him at the athletic club, and I didn't want to be Mrs. Board of Health, but I did say, so you going to knock that thing down, or you're waiting for it to fall down by itself? And he said he didn't want to knock it down, in fact, but he was having trouble with the insurance company. He didn't feel that they were valuing the house properly. And so he was in a long negotiation with them. So that's part of what's been the problem. And I suppose from their point of view, the longer he waits, the longer they get to hang on to his money.
How long has it been, Kat?
It's been
How
at
many
least
years?
It's been at least 3.
Mhm.
I can't remember the exact date of that fire. It was in January. It was like New Year's Day, or New Year's Eve even, and it couldn't have been any later than 2019, and it might have been 2018. I just don't remember. But it's been a good long time.
Yeah, I think he
Bad long
needs
time.
to. I think he needs to have a message from us that he needs to keep making progress.
For sure. For sure. Well, that's why we're only giving him a month at a time in deadline extensions. Now, Charlie, way back in the summer was saying, if he doesn't meet the August 1st deadline, you should take him to court. But I just don't see how that could possibly be productive. It's not like he's just sitting on his hands waiting, letting the place be a nuisance.
I know at one point we had asked him to come to a meeting and he didn't. Is there a reason why he's not coming and talking to us, all of us? I know he's talking to you.
I think there are a few reasons. I think he's got he's got some tech problems and maybe some tech phobias, and he's not well. And so the amount of screen time and stuff that he can put in each day is limited, and the other kinds of time. So he's somewhat better than he was a few weeks ago, apparently, but there's all kinds of, he was getting neurological consultations, and he's been having migraines and real problems. So I think that's
Okay.
it. And I think it's just kind of a stress thing. I had enlisted Ken Rotundi to possibly help with the boarding up project. And Ken was willing to do that, but it's starting to seem like a pointless exercise to insist on that.
That was Charlie insisting on that, right?
Yeah. Yeah, and I took his word for it, but if it could have been done easily and quickly and cheaply, it would have been one thing. But since it couldn't, it hardly seems worth the trouble, especially since, as Greg pointed out, one, plywood costs are expensive, and two, there's plenty of hurricane victims and stuff that need it more than he does. And three, we're hoping that the house itself is going to be torn down within a few months. It would be excellent if that house could go before winter.
Mhm.
Ken and he apparently even talked about the possibility of letting the fire department burn it down as practice. But I don't know if anybody's followed up on that. In order to do that, you have to remove all the possible hazardous stuff from the house. So it's not without labor.
And it may not be allowable per the insurance.
Well, that's an interesting thought.
He may not be able to execute a claim.
Well, it's not our problem in any case. That's
Right.
just, information.
All right. Well, thanks for the update. And I think we need to stick to it. Stick to our strategy. Yeah.
So we will
Monthly.
extend his deadline until October 1st. Any objections to that? Hearing none, we will say October 1st. So we have all the PFAS test reports from the original UMass testing. Let me find that. And we have some of the reports from the DEP investigation. Caprice said she had a bunch of non-detects, but she hasn't, she was going to send me a table, but I haven't received it yet, unfortunately. So from UMass, well, here's sort of the big picture. Where we have PFAS is primarily at the fire station. And oh my God, the fire station has, okay, remember the deal. Massachusetts has a maximum allowable limit of 20 parts per trillion. EPA has a maximum allowable limit of 70 parts per trillion. At more than 90 is considered an emergency situation. Okay, the fire station, where did it go? Has 129 parts per trillion, and the fire station well also serves the two houses on either side, and one of them is currently uninhabited but has recently been bought. That's the parsonage of the Baptist church, and it's recently been bought. Becky has already ordered a filter for the downhill one, and she has had water delivered, bottled water delivered to both of those houses, and she's presumably also ordering a filter for the parsonage, the former parsonage. The highway department has 95.4. And there are so far a few houses both up and down the road, apparently, that are over 20, going from 21.1 to 40.2. They're fairly tightly linked to the fire station. And there's still more. There's a few more tests to come in from DEP.
And when you say fairly tightly linked to the fire station, that's the assessment of DEP through their investigation?
No, I mean, I'm just looking at these addresses and seeing that they're all fairly close to the fire station, and we're not seeing a huge extent. These addresses that we have now go from number 20 to number 62, and they're on both sides of the road.
I'm not sure any of us know the answer to this, but are we certain that the filtering is still effective at these levels? These high levels?
That's a really good question. I believe, my understanding is, and I don't really know a lot about it, that the filtering capacity is there. If there's a lot of it, the filters are going to clog up or become waterlogged or PFAS logged sooner, but they're still going to do the job. They're just going to have to be changed or cleaned or whatever has to happen to them more often. I also should have mentioned at 63 Leverett Road, which is behind the highway department, that was one of the first ones that we discovered with an 85. So closest to the fire station and the highway department is the worst.
And you mentioned that the town, have they assumed the cost and responsibility of delivering the bottled water?
Yeah.
So what is the town's obligation?
Well,
are they buying filters as well?
Yes, they bought the filter for the Watkinses behind the highway department. They bought the filter for number 50, which is downhill of the fire station. They're going to be buying a filter for number 32. How far it'll go, I'm not sure, but I mean, there hasn't been any question about it. I mean, Becky is just, presumably with the sanction of the select board, she is just providing bottled water and filters to the places that are obviously or apparently contaminated by the fire station well. And the fire station situation.
And are these households being counseled by the state or
Yeah.
anyone? Yeah. Okay, good.
Yeah, because DEP found most of these, and they've had phone calls from Caprice Shaw, who is running the investigation in Shutesbury. She is instructing them to call the Board of Health, so they get to talk to me as well, but I don't know anything really.
Right.
But I just try to reassure them and feel sorry for them and whatnot.
Yeah.
So there's that. Now we also have one address out Pelham, fairly far out on Pelham Hill Road, which has a 34. We don't have any other what are these non-detect? We don't have any other samples from out there. The only other one on Pelham Hill Road is way close to Leverett Road. So we don't know. Caprice said she might be able to do some testing out there. And I think there are some private individuals that might want to do testing there as well. And of course, the other area where it's been found in any significant way is Old Orchard Road. And that doesn't go very far from Old Orchard Road. There don't seem to be any on Wendell Road, for example. Let me just check the low values and see.
And Kat, I can't remember, did we have any suspected sites or suspected problem areas on Pelham Hill?
No,
I mean, I know we did an orchard, so.
no, we didn't have anything.
So
on-
it would be
on
good if the
Pelham Hill.
state could do some more investigation down there.
It really would. I don't know. I've asked Caprice if she's going to do that, and she said she thought she could. And yeah, I don't know what the deal is, but you know, back in the good old days, people used to just throw everything out in the woods, and
Right.
Private
presumably,
property dump site. Yeah.
yeah, and there's probably something like that out in the woods behind this place, and no telling how many other properties are affected. So I'm hoping that she's going to come in and offer some testing.
Well, it'll also be interesting, Kat, and I hope we get some results from some of the other small towns, you know, like ours that are on wells, and see, you know, what the extent of, you know, their finding in their communities as well.
Yeah, that will be interesting. I'll ask Caprice, and I'll also ask Jody Cutler, because I mean she's really part of the survey.
I just can't imagine that we're an outlier.
No, I can't either.
No.
But
Oh no,
No.
somebody was telling me that in some of the towns in the eastern part of the state, they have much higher levels. They're having a lot more in them at much higher levels. And these are high, but they're not
Oh,
what's
really?
being seen elsewhere.
Ooh.
Yeah.
So 129 was not high. I
Well,
mean,
it's high.
but
It's high,
but-
but they're
yeah.
seeing higher. They're seeing higher levels than that.
okay,
elsewhere.
well, that's an interesting perspective.
Yeah. There was also another interesting thing that Caprice told me. There is a place that's, I guess it's, hang on. That's up the hill toward Town Hall, where the deep well, and I don't know why he's got tests here, but the deep well is 23.8 and the shallow well is only 2.1. Just kind of disturbing to think that it's in the deep wells, deep down in the water table, or the fractures.
Sounds like a question for Al.
Yeah, I was just thinking I'll ask him about that. If you guys don't mind, I'll share this information with him.
Yeah, that would, and from my point of view, that would be excellent.
Yeah, I'm trying, to protect people's privacy, but on the other hand, Al really knows what he's talking about. Marianne told me today that they're going to be doing extensive water testing behind Town Hall and in Lot 032 as part of the site selection for the potential new library. So we should get some other interesting information from that, and I think they're starting next week. So that's what I know. All right, we're getting some more non-detects, but I was really, let me check and make sure she didn't send me them. No, I asked her if she could try to get them for me in time for our meeting, but she didn't. So to be continued. You probably saw the notes. Brad Foster, that guy who came in and we were going around and around and around about the new well, back to square one, he needs a septic system too. So one of those well sites is probably going to get used, or they might get swapped, or who knows, but he'll be coming back to us. So.
And
So,
that
yeah.
was determined as they started to try to figure out the new well, or?
I'm not sure exactly how they discovered it, but he told me that there was some kind of, he was seeing seepage from the septic system. So we brought in Bill Saruta, and Bill said, you need a new system. And I advised him to pump out the tank just to reduce the whatever's going on. So that's that. And Noreen, an email was sent to us from FERCOG. It made its way to us elsewhere in the town, asking us to name our delegate to the Franklin Regional Public Health something oversight board. And if I understand it properly, that's that group of Phoebes. And so I didn't answer. I just sent, it came from Linda Scott. It had been sent to Linda Scott somehow. And she forwarded it to me, and I said, this is a mistake. We're not part of that program, and we're not represented on the oversight board. I didn't go on to say, even if they asked us to be on the oversight board, we wouldn't do it. No way. So I just wanted to make sure that that was the right thing, that it was in fact an error as you understand it.
I'm really not sure what, I mean, there's a group that Phoebe has that she calls a roundtable, which is bringing all the boards together on a monthly basis to talk about public health issues. And we had been asking to be included in that, just so that we were part of the group that was able to talk about public health issues. Because when we're in our emergency planning meetings, there's been sort of this rule that we're not allowed to talk about anything except emergency planning and no other public health issues. The grant is kind of limited in that sense. I'm sure Garrett can speak to that more articulately than I am. So I have been participating in the public health roundtable, just to have a sense of what other small towns in Franklin County are doing on any public health issue that comes up, whether it's insect-borne illness or anything, water issues like this, or dealing with hoarders.
What this seemed to be was the Cooperative Public Health Service Health District.
Yeah, I'm not sure what that is.
And that's the group. The 16 towns that use the public health services that Phoebe provides. And the public health nurse and the health director and all that stuff.
Right.
So, well, if it's wrong, we'll find out. But it's not the
Okay.
round table. It's something different from that.
Okay.
And if you need a sacrificial lamb, I'll do it.
Oh, Garrett, what
I'll
a
do it.
star! What a star! But I don't even think that we are. What's the word I want? That it's permissible for us to be on it. But maybe I should double check with that.
Because we belong to a different health district, Kat?
Yeah,
Why are you saying that? Okay.
yeah.
Because we're members of a different health district. Yeah.
Right.
That's a good point.
Here, let me find this.
Does WIM even know what we're talking about?
Oh,
maybe not.
There are two health districts. You can help me, everybody. There are two health districts in Franklin County, and it's pretty much the eastern part of the county is one health district. And then we're part of our own health district with Irving, ourselves, Northfield.
Wendell?
Right.
Is Wendell? in
No.
there?
No. And we
Um,
hire our health agents through that health district. And when COVID happened, there was some funding available to each health districts. And it's a whole statute that created these health districts probably, 30 years ago, a while ago.
Yeah.
And ours is pretty informal, but this other group is part of FERCog and has, does all of their administrative business through FERCog, whereas we do not. We, run our own little health district. And CAD is our representative to the health district.
Kat, does that email seem to suggest that it might be related to the Public Health Excellence Grant or to the case
No.
investigation or contact tracing grant from the state?
No. In fact, the title on the PDF is FY22 Appointment of Reps to CPHS. And CPHS is the Cooperative Public Health Service.
Yeah.
And Cooperative Public Health Service is the group of 16 towns, of which Shutesbury is not one, that use the COG basically as their health district.
Yeah, I think it's just a follow-up to Phoebe to say, was this incorrect?
The person who actually sent it wasn't Phoebe, but I think Rebecca Boyd. So I'll just double check it with Rebecca Boyd, but I don't see. Whoa.
hey,
But we don't appoint anybody to CPHS because we're not members.
Then I'm off the hook.
Yeah, I think so, Garrett. I mean,
You're welcome to come to MAFCO, Garrett.
It was noble.
I'll ride with you.
There's just one other thing. I'm kind of sorry Arlene isn't here because she might remember more. Noreen, you probably remember this. Remember 66 Lake Drive?
Yes. No, don't tell me.
The problem with it right now, the septic system seems to be fine. The well seems to be fine as far as we know. The problem with it right now is something really weird, and it's come before Concom. So Miriam called me a few days ago, and we went and looked at it. There is a sort of a storm drain going down the what would that be? The south side of the yard, the side between him and Mark Rivers.
Right. Yeah, I'm very familiar with it, Kat.
Okay, so you know about that drain.
Oh, I do.
And so Bob Douglas is complaining that that he's getting all the runoff through that drain because all the other neighbors have bermed their driveways. And further, he claims that the Board of Health insisted that he have that drain in the first place. Now, I don't think so. I don't know where that drain came from. I mean, there's nothing in our minutes. There's nothing in our septic system permit about that. There is a curtain drain, but that's way down by the house and it goes to the other side, apparently. And so I kind of passed this information on to Miriam. I don't know if you remember anything more about that.
I remember them putting that septic in and that whole new system.
Yeah, it was a really fancy thing.
Really, yes, and expensive.
Mhm.
You know, I seem to remember it more pertaining to his well was in front of the house. And he had trouble in his well, Cat. And is that why we wanted that?
Well,
It's a shallow
remember-
well. It's in front of the house.
Didn't he get another well someplace else?
No, what happened was he
Evan
was
bought the land
supposed to.
out from under him.
Yes,
Yeah.
exactly.
Yeah. Right. Still, I don't see what good this storm drain would be doing and why we would have insisted on it. I can see that we may have insisted on the curtain drain, but that's not what this is. You've seen it. It's right up there by the road.
Yeah.
So I told Miriam that if we can't find anything about it, they could probably just have it covered up and bermed up and let the runoff go someplace else, because it's basically a big flume straight into the lake with all the runoff
Right
from
there.
up
Yeah, with all the runoff. Yeah.
Yeah.
Okay.
So I
It
said,
is true. He is taking a terrible amount of stormwater over there.
yeah. It looks like I hadn't realized before how it's at the low point of that road. The road takes a dip and he's right there.
Well,
And Great Pines is right there too. And everything just goes right down that hole,
yes.
which is kind of collapsing. You know, they've got it with riprap and it's kind of slumping.
Yeah.
It doesn't look good. Okay, well, I sent the notes. We have detailed notes from the hearing that we had before issuing that permit. Because remember, we were not convinced for a long time. I'm glad Bill was there. And it doesn't say anything about a storm drain from the road. So as far as I'm concerned, whatever Concom decides is fine with us. So that's all that's going on with me. Anything else to add?
Has anyone been following the update on Delta and in the state or county or locally?
Garrett, you must be following that, huh?
I mean, it seems as if we're better off here than other parts of the state, but you know, in terms of booster doses, DPH is surveying public health to find out if they want to do clinics and they want access to vaccine at smaller dose increments than what they were originally requiring. So, you know, I think for us, it's kind of wait and see what happens with the colleges.
Right.
As of yesterday, I looked, there were 6 per 100,000 in Franklin County infection rate. So,
Is that doesn't seem like a lot.
no,
And that's infection rate. It doesn't have anything to do with how many people are being hospitalized, for example.
no.
Mhm. Yeah, somebody told me today that it seems to have leveled off a little bit in Massachusetts generally, but I think a little spike is expected because of all the students coming back from God knows where.
Yeah, and you know, the UMass plan is if you have an exemption from vaccination, you have to get tested twice a week.
Mhm.
Otherwise, everyone must be vaccinated.
That'll help.
Yeah.
Yeah, I kind of don't know what to think about this infection rate because you know, infections are being found that way that might not even be noticed otherwise. I mean, I assume we're not seeing a huge uptick in, as some other states are, in emergency room visits and
Yeah.
deaths and stuff.
Well, even just people I know who have been vaccinated or fully vaccinated and are now contracting
Uh-huh.
COVID. I've been surprised by the number of personal friends I know.
No kidding.
Yeah.
Hmm.
Yeah.
And are they getting severely ill, or
No,
they just
mild, but still like loss of smell and taste, and
oh God, that's my
Headaches.
worst nightmare.
yeah.
Okay.
All right, so the guidance remains pretty much the same.
Okay.
Yeah.
Okay. When, they were talking about having Celebrate Shutesbury, but when the Delta started making headlines, they didn't even decide not to do it. They just quit talking about it and just disappeared.
Yeah, that's probably smart.
Sorry?
That's probably a smart decision.
Yeah, I think so too. Marianne is, I think as of today, opening the library for people to come in, but she's limiting the numbers. Basically, you can have a family, or you can have like 4 unrelated people, although 4 is a stretch. And that seems safe enough to me. They have to be masked and so on. Anything else we ought to be talking about?
Who has the
Okay.
clock? Who has the ticking clock?
Oh, I'm sorry. That's me.
Cat.
Oh,
Sorry.
thought we had a time bomb going
Right.
off or something. Yeah.
Right. Sorry about that. If you'd mentioned it long ago, I would have moved it long ago, but I totally forgot about it. I always like to have a lot of clocks around. All right. Well, I guess we are done. We can meet again on the 15th, I assume.
All right.
And that's it.
So I'll move to adjourn.
I second that motion enthusiastically. All in
Sounds good.
favor?
Yay.
Yes.
And with that, I will stop recording.
Okay. Thanks, you guys.
So long.
Thank you, Kat.
Good night.